I'm excited to tell you what I do. My name is David Allen. I'm a tattooer. Ooh, there we go. I'm a tattooer. I'm a painter. I'm from Chicago, Illinois. I do post-mastectomy tattoos in addition to other tattoos. I want to give you a little context to my story, and then I'll show you some pictures of these. So this at first, to me, the learning process, it was technical. It was black and white. And it became fluid. It became kind of gray. So I love the aspect of learning here with tattoos. I love being able to really challenge myself. I tend to be pretty adept at anything artistic. But the learning curve with tattooing was difficult because it's on people. And you understand this, but as an artist, I had a lot to take in. I had to learn how the skin responds. Everyone responds differently. Everybody's tolerance for pain is different. I don't get to put people under anesthetic. The nuance of the skin, it takes about 15 to 20 minutes to start to really understand how someone's skin responds. I loved all this stuff. I loved the technical part because I was an artist. I was going to use this medium to show my work, to show what I did. And I thought that was the course it was going. I was getting pretty good. About 5 years in, I realized that I could pick up on the vibratory response of the epidermis. So my left hand stretches the skin, and I'm tattooing you, and as I'm doing so, I started to see kind of in my head with my hand how deep I was going into the skin. This is important because you usually can't see that. This took time, this took muscle memory. I was proud. Then I really started pushing my own craft. Well, something happened. I had a client sit with me for a couple hours, and he had one of the best tattoos I've ever seen. It was by one of the best tattoo artists in the world. It was impeccable. It was technically sound. The lines were solid. The shading was perfect. And I was excited to ask him about the story, about the tattoo. And his only response was negative. The tattoo was not what he wanted, and the experience really affected him. He didn't like that tattoo. To me, it was beautiful, but it wasn't what he wanted, and the experience changed him. He wasn't shown any value in that process. That really moved me. It made me realize that as an artist, I may be able to do my own thing, but if I'm working with a client or with a patient, I have to meet them differently. I have to meet them where they are. This isn't about my ego per se. So I'll never forget this. I had a young couple come in. They were late 20s, and they wanted a plus sign tattoo. Little small tattoos are difficult because you have to be very accurate. But I could tell they were down because, you get used to mirroring emotions. They had just miscarried. She had lost her baby, and the best part of that process for them was when they were looking at the pregnancy test and it was positive. We have this life that we live, and I got to jump in their lives for a day. I knew at that point that the tattoo needed to be damn near, perfect, but also the experience had to be incredible as well. I had to love on them. I had to be present. I had to remove myself. I did not think about what I was going to say next, but I needed to be present and listen. The next day, I got an email about a post-mastectomy tattoo. I'd never done them before. I was ready. I had decided to do it. I did this post-mastectomy tattoo, and it changed my life. Things had been leading up to this. In the middle of the tattoo, I had to stop. I went to the bathroom, and I cried. I had to let it all out. I realized for the first time that I was directly using my craft. I was directly using my skill, my talent, my time to help somebody. Now, you know what that's like. You made that choice. I didn't necessarily make that choice. I'm an artist. It's a little more ego-based. But it hit me hard, and I realized that there was more I could do with my art. There was more I could do with this talent. I'm going to show you some of these tattoos. Oh, there's a little video, like a 30-second video. That'll play, and then there we go. Well, the video didn't play, so that's okay. You got it up there? Oh, thanks. I just use a fine needle. It's 3 needles pointed to one point, and I just slowly chip these tattoos in. The skin responds so differently if it's been radiated or if it hasn't or if there's scarring. So it's kind of feeling them out and also feeling out the skin. It's an arduous process. Ooh, me in slow motion. Okay. Some don't necessarily have reconstructions. These are all in response to what they need and what they are struggling with. That took me some time because I don't see people like they see themselves, and I'll bring that up in a second. But the big deal here is I needed to meet them where they were, and it took some skills to be able to do that. So real fast, I'm gonna go over, I just have 3 points. I realize that I spend 4 to 8 hours with people. That's not normal. And they're not under anesthetic. My people are awake. There's a lot of story there. There's a lot of backstory, and there's a lot of listening that has to happen. But in that process, I'm able to kind of tailor these and customize these to their needs. The stages. We use a carbon-based stencil. We design these in Photoshop first, so they can actually see what it might look like before we even put them on them. We don't see people as they see themselves. These are simple points, but they've really, really changed me. We may have a better understanding aesthetically, compositionally, anatomically. We may have a better understanding, but we are not these women. I'm not the woman that moved her bathroom mirror away from her shower so she doesn't have to see herself when she comes out of it. I have to be neutral. I have to remember this. When I come into this, it's very important to have an empty baseline. So I'm not projecting myself onto these people, onto these women, so I can kind of hear and get the context. The more a person connects to you, the more history you'll receive. The more history you receive, the more accurate your context. And if your context is accurate, your empathy can be accurate. When you walk into the room, and if you haven't picked up on a patient's nonverbal gestures in the first 30 seconds, why would they be vulnerable with you? Why would they give you a robust history? I wouldn't. And last, this is obvious, but including people in your process is imperative. It's so easy to get wrapped up in what you want and what you want to do that the final product doesn't become a part of them. I have a friend, Dr. Kevin Bethke at Northwestern. We've talked about this a lot, and his big deal is he likes to include a woman, actually collaborate. So it's not just him guiding her, but she becomes a project manager in her own process. This is his version of tempering the absence of control. After I learned these tools and have been using them over and over and paying attention and being present, it really became easy to remove myself. I have other venues, I paint, I do other things to get the creativity out when I just want to do whatever I want. But this has changed me. This has been the most beautiful thing in my life now, and I'm going to show you a few more of these tattoos. This is me learning the hierarchy I'm talking about. Some women struggle with the radiation tattoo dot more than all of the scarring. That surprised me. Some have an issue with the chemo port and nothing else. Some is the dimpling, or some they just miss the shape of this breast over this, or one breast is 3 inches higher. So I can optically kind of learn their constraints and use design principles to kind of trick the eye. This is a Photoshop thumbnail. I give them 3 to 5 options and then they can choose. I cry a lot. I cry all the time. So my role in this is obvious. I am a vessel. I'm a tool of sorts as a means to take back control, one in which we collectively establish a new point of reference. So the final product, the tattoo, it's important, it matters, but just as important is emotional attunement. Thank you for listening.